and welcome to YHM Community. Today we're talking about, ooh la la, sex in pregnancy. So this is often a really taboo topic, and often you get pregnant and then you think, is sex safe? What do I need to know? And more importantly, who do I talk to about it? Do I ask friends, family members? Do I have to go to my midwife or doctor to ask if it's safe? So I thought, let's do this video today and dispel some of the myths around sex during pregnancy, but also make sure we give you evidence-based information so you can rest assured about having sex in pregnancy. So my name's Nicola, I'm a midwife, I'm a yoga teacher specialising in pregnancy and postnatal yoga, and I'm also a birth educator, so I teach birth preparation and hypnobirthing courses via Zoom too. But let's dive into the important topic today of sex during pregnancy. So, my friends, number one, the most important thing to know is that for women with a healthy pregnancy and no kind of health concerns at all, sex is safe during pregnancy. It's really important to know that having sex in pregnancy is not going to harm your baby as long as you have a healthy pregnancy and you've not been told not to by your health care providers. And it's really reassuring to know that if you're having sex with your partner or using a toy, a penis or a penetrative sex toy is not going to pass beyond the vagina, which means it's not going to harm or affect your baby, and your baby is not going to know what's going on. So be rest assured for both men and women that sex is safe during pregnancy and it's not going to harm your baby. That is the number one concern, of course, for pregnant mothers and fathers-to-be for their baby's health and safety. So be rest assured with that. Absolutely. So my next point number two, is about your sex drive. So it's really important to know that you might notice that your sex drive or your libido changes during pregnancy. It might go up and it might go down. Both are normal. Please do not criticize yourself. Whatever happens with your sex drive during pregnancy, it's completely normal. It might go up, it might go down, it might stay the same. But just the really important thing to do is communicate this with your partner or your sexual partner. So if you do notice a change, then try and have an open and honest conversation about that change to your libido or your sex drive in your pregnancy. And your libido in pregnancy might be a little bit like a lift. It might go up to the top floor, it might go all the way down the ground floor and stay there. It might start to go up and down throughout the pregnancy and change constantly. It's all normal. There's a lot of changes going on to your body during pregnancy. So please just be rest assured that it's normal and try and have an open and honest conversation with your sexual partner about that. Okay, so the next thing is about positions during pregnancy. So you might often think, very loud motorbike, sorry about that. You might often think, what positions can I use during pregnancy? What's right and what's wrong? And the main thing is, it's not really right or wrong positions during pregnancy, but you might find that you need to adapt the positions that you use purely for a comfort basis. So as your bump starts to grow, your posture starts to change, your pregnancy develops, you might find that positions you used before start to become quite uncomfortable for you. So just experiment with your partner, different positions to try and be as comfortable as you possibly can so you can of course enjoy the experience, which is what we want. So with that, I just say experiment with your partner and find what feels good for you. There's no right or wrong way, but you might need to adapt the positions you use for having sex during pregnancy. Okay, so the next thing is about sex triggering labour. So often it's thought that if you have sex, it's going to kickstart labour, maybe sooner than wanted, or if you've gone past your due date. So the main thing is, if you have no history of premature birth, so you're not at a high risk of having a premature birth, which I'll come on to in a little bit, then if your body is not ready, then sex is not going to trigger labour. So, but later in pregnancy, as you get closer to your due date and maybe your body starts to prepare, then maybe by having sex might actually start some Braxton Hicks or even some contractions themselves. And the reason for that is that during sex you can release oxytocin, which is our love hormone, which we also release during labour. And I talk more about this in detail in my hypnobirthing courses. But also the release of prostaglandins in the sperm can also help to ripen the cervix, which is very weird terminology to say about ripening your cervix like it's a piece of fruit. But what that means, it can start to soften the cervix and it can start to dilate slightly too. So if you're later in pregnancy and your body's already maybe starting to prepare for labour, you might notice after you have sex, you might have some contractions and you might have some Braxton Hicks. If that happens and you have any concerns, then of course, ring the hospital and they can advise you from there. Okay, so the next thing is when should I avoid having sex in pregnancy? So there are a group of women that might be advised not to have sex during pregnancy. So I'll go through a few of those now. So the first one is if you're having heavy bleeding during pregnancy, you might be advised to avoid sex during pregnancy. Also, if your placenta is lying low, also known as placenta previa, again, you might be advised to avoid having sex. If you have a multiple pregnancy, if you're having twins or triplets, let's see what else. If your waters have broken just because of the increased risk to infection, if you have a higher risk of premature labour, if you've had premature labours in the past or you're at higher risk during this pregnancy for whatever reason, again, they might advise to avoid sex later in pregnancy or when you're getting closer to that time that you previously went into premature labour. And lastly, if there's any kind of concerns with your cervix at all, again, your healthcare professionals might advise that you avoid having sex during pregnancy. So if you have any of those concerns or complications even, or history, then please speak to your healthcare professional to get individualised professional advice about how to be safe during your pregnancy in terms of having sex, and they will advise you from there. For everybody else, if you have a safe pregnancy with no complications and you've not been told not to have sex during your pregnancy by your healthcare provider, then be rest assured that having sex during your pregnancy is safe for you and safe for your baby. But just remember the key things of communication with your sexual partner, just not criticising yourself for maybe changes in your libido, which are completely safe and natural and healthy to have during your pregnancy. And also, if you do have concerns, then please speak to your healthcare professional at any point that you need to. So thank you so much for watching this video today. I hope you found it useful. If you have, then please give it a cheeky like just down here, and also hit that big fat red button also down below, and subscribe to my YouTube channel. So I now release videos every week, and I'm going to be doing lots more pregnancy information videos on lots of topics, as well as pregnancy yoga focused things. So pregnancy yoga flows, pregnancy yoga for beginners, labour preparation. And also, lastly, if you're interested in my other services, so one-to-one yoga on Zoom, or my birth preparation courses, which I know I'm biased, I teach them, I highly recommend. I actually think that all women should do a birth preparation course in labour, because in pregnancy even, ready for labour, because I know how much benefit it has for women to prepare themselves for labour and therefore have a better labour experience. Quicker labour, your body works more efficiently, you have better recovery too. So if that's something you're interested in, or if you want more information, then check out my description below with all my links to my website, a bit of information about what hypnobirthing is, how you book, and also all my contact details as well. I would love to welcome you to a birth preparation course or to my yoga classes via Zoom too. So I think that's everything. That's a wrap, as they say. So have a fantastic day, and I really hope to see you soon for some more pregnancy information videos, yoga videos, and everything else too. Have a wonderful day, and namaste.